Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
Hi, I'm Karen Vandenberg and I am one of the founder members of the Endometriosis Support Group.
I'm Sharon Lunt and I'm the other founding member of the Endometriosis Support Group. I think people have been more open to talk about it, and when they realise that we've put it on the radio and it's not as taboo, people have been more forthcoming with it. I think the group obviously does shine a light on things, and people are prepared to share more in the group than they possibly would do anywhere else, because they know that the other people on that group are also in the same shoes, in the same boat kind of thing. So
yeah, and there's always a pattern really in the questions that people are asking, and it's usually around how do I access the right surgery, how do I access diagnosis, and I think that is the main focus for most people, because that's the most important thing really, is to be able to get a diagnosis and get the right surgery, because not all surgery is equal, which I think is what we
said last time.
And it's not just within the Isle of Man, it's not just within the United Kingdom, it's a worldwide problem. Obviously, we did talk about how the specialist centres, and from the island, if you're referred, you go to either Manchester or Liverpool. There's lots of different specialist centres throughout the United Kingdom, and you can go private, which a lot of people do if they're fortunate enough to have health insurance or be able to afford it. But one of the things is as well that even if you go to a specialist unit, not all specialist units are equal in their quality of their care, which has been highlighted through a report that a lady in the United Kingdom has been collating for the last 2 years. It's called Endometriosis in the Knowledge Gap. I contributed my information as one of the case studies, and it highlighted that we still need lots more upskilling and education across the board with regards to endometriosis within the medical profession, but also for patients, so that they know what to ask for. They know if they feel confident to say, no, I don't want that. Actually, I want a second opinion. I'm not just accepting that. And it's not about it being like, pointing the finger, you're not doing your job right or anything like that. It's about being collaborative and working together so that we can raise education standards and upskill, so that people aren't living with the symptoms and how devastating this condition can be.
We need to have some sort of pathway from the Isle of Man. We've got 262 members now on the group. Most of them are still awaiting diagnosis. A lot of them are still battling with the care over here. And what we need is some sort of pathway to the UK, but obviously the UK are also having spotlight on women's health as well. They are obviously under a lot of backlog. I think the stat was close to 1 million people in the UK, or 1 million women in the UK are waiting for endometriosis diagnosis in the UK as well. So we also need to try and fit in there somewhere. And the problem that we have is obviously we've actually stopped surgeries over here, and obviously yet again gynae was one of the first to go. It's not good enough.
No, it's not. And obviously there's funding and there's across the board, isn't it? But it's about having that pathway in place in the first place and having speedier access to diagnosis, because you could cut down on all of the money that's been spent on these women whilst they're waiting for different medications, time off work. It affects so many aspects of a person's life. And one of the reasons that there's so many advocates for endometriosis now is because we just need to upskill the medical professionals so that people can access as soon as possible. I mean, I'll give you a few statistics from the report that was presented in the Houses of Parliament in the UK on the 6th of March that came from this report. So it was only 40 case studies, but she had so many more other people come forward, but she just had to cut it down. So it was the person's medical records and an interview with them. And I think what it highlights is what we already know. So 85% of all scans miss disease. 65% of all surgeries miss disease. Okay. When they went for a second opinion from their scans, their existing scans, 100% of cases were diagnosed for those people. And then for the surgery, where 65% of surgeries missed, 83% had confirmation from their surgery with a specialist. But at the time of the report, 17% of those then were awaiting further surgery. So it's just showing the knowledge gap there, and the skill base that we need to change that. And this is across the board.
It's not just an Isle of Man problem, but obviously we have the water in the middle, which obviously causes quite a big gap for us as well. That obviously we have these women that need care, and we're trying to shoehorn them into what is already an astronomical waiting list, because obviously those figures, while Karen is obviously on the Isle of Man, her surgery was in the UK. So it is a UK stat. So we're trying to now fit our patients into an already overloaded system, and we've been waiting a long time. I mean, you think my surgery, I first went back to the GP about my endometriosis returning in 2019. Obviously, COVID happened, so everything stopped, gynae stopped, everything stopped. Then I eventually got back in around 2022, I think. I had my surgery 2023. I am 3 months post-surgery in Manchester. And hopefully that's my journey over. As far as endometriosis is concerned, I had full excision and a hysterectomy while I was over there. But they're working 7 days a week. They are doing 15, 16 surgeries 7 days a week. I know there's a few girls going to Manchester from our group within the next few months. But we've just got so much further to go.
It's very worrying because, you know, when we look at the island, we understand the problems or the issues on the island. And then when you widen it out to the UK, which is what most of the ladies from the group rely on, because like you said, you know, they also need to fit in with the healthcare there. It's very worrying and concerning. Have y'all been able to chat with anyone, maybe from Manx Care or from the UK?
So we did have a positive meeting about longer than 6 months ago now, wasn't it? About 8 months ago. They did. So we talked about a documentary that was being aired last year, Below the Belt. And Manx Care have actually taken that on, and students from September, I believe it was.
I don't know because whether it will just be getting rolled out like that, because obviously it has been funded.
Yeah.
And Sharon and myself have been working with professionals within the Women's and Healthcare Directorate. That has slowed down a bit recently for changes that might be happening within that department. But one of the things that we were working with them is presenting the documentary in a training session for obviously medical professionals, and that was going to be put out. And obviously there would be a doctor there to talk about endometriosis, and Sharon and myself to talk about the patient journey. I think that was going to be the launch of the use of the documentary. And then going forward from there, we probably will needing to, and hopefully will, have more meetings where we can plan how, you know, we can get it agreed to be part of the education programme used on the island on a regular basis. And obviously when we're looking at education and pathways, it's obviously we're interested in the Isle of Man, but we're also interested in the broader picture across the United Kingdom, because that hopefully will filter down into what we can do. Because obviously our nursing programme on the island is from Chester University. So, you know, if Chester University start having that incorporated in their programme, then it would be down for us. And obviously our medics that come as students, they're usually obviously off island, aren't they? And they come here for placements. So we would hope that there's going to be a change across the board within the United Kingdom with regards to education and training, from sort of undergrad to postgrad to ongoing and upskilling throughout, and maintaining that professional competence and having that interest and specialising in that area. Because I think in an ideal world, what we would be looking at is listening more. I suppose that's not an ideal world. That's what should be happening. We should be listening to the patient, listening to this woman or this young girl that's coming into the GP surgery or presenting at A&E. Because from the report that I talked about earlier, 65% of the people who provided their information, their onset of their condition was 16 years or under, with 5% of them being pre-menarche, so pre-puberty. So that is where we need to be understanding and getting involved, because it's about prevention of this disease continuing to grow, really.
It's the damage that it can do during that period while it's left unchecked. And you can pop people on contraceptive, on hormones, on the injections, on the new medicine that's just come out. You can pop people on that to manage their symptoms until they can get a proper diagnosis and excision surgery, but it's not a cure, and the disease can still continue to grow in the background. And while you are on this medication, if it is masking your symptoms, you tend to not shout as loud, you tend to not push. And I've seen it where people have they've gone, oh, well, your symptoms have stopped, we'll discharge you. But you've then gone 5-6 years without any surgery. And then when they do look inside, it's ravaged organs that then can't be
salvaged in some cases. I mean, you can have like kidney failure and not know silent kidney failure. That is one of the main sort of organ failures that you can have with endometriosis, and that's devastating. So it's really important that early diagnosis and listening to young girls who are presenting, and obviously women who they've only presented maybe for the first time when they get older, but listening to them and not just saying, oh, it's normal to have heavy periods. It's normal to be fatigued. It's normal to
be in pain.
It's not normal. A normal period might have a little bit of pain, but it shouldn't stop you from functioning within your day-to-day life. That is not normal. And I think one of the things that obviously, because it gets considered as a gynae disease, because obviously it does involve gynecological parts, it's not. It's a whole body disease. And I think as well, not just because of because it's endometriosis and you do obviously get pain with that, women's pain gets normalised across the board, doesn't it? And I think that's another barrier that needs to be overcome, because if that's overcome, when a woman comes and says, I'm having this debilitating pain and I can't function, oh, well, it's only for 2 weeks of the month. It's not all of the time. So just get on with it. Well, no, don't just get on with it.
It's half your life.
Yeah, why should you have to do that? Nobody should have to do that. And there has to be a reason. Your body is telling you that there's some form of inflammation there that needs to be addressed. And like Sharon said, you can be prescribed medications and there can be a place for them for a period of time, but it's not a long-term answer, and it doesn't address...
Not
lifelong, and it doesn't address the underlying problem. I think there's been a lot in the news, obviously just over the last 24 hours, about this new wonder drug. Now, if people go on to actually Endometriosis UK, there was some information posted. And also Nancy's Nook, which a lot of the ladies on our page are members of, which obviously specialises in information about endometriosis. It's top of its game for the information. Now, nobody is saying don't take this medication. We're not doctors. But what it is this medication is a oral form of the Lupron or the Prostrap, but it has HRT with it, whereas if you have Lupron or ProStrap, you usually get HRT add back. So it's not different. It's still what you would call a GRNH medication, and it does come with long-term implications. And for some people, a specialist might even say, yeah, okay, have this for a period of time. The problem with taking it is if you're going for surgery, it changes the appearance of the lesions. And unless your surgeon is really a specialist, they might not recognise the lesions then when they go in to do the surgery. But if you read the actual leaflet on Lupron, I haven't obviously on the new medication that's come out, but it is obviously the same type of drug. You take for 6 months for one time, and you maybe should take for another 6 months at another time in your life because of the potential bone density problems, heart problems, cognitive issues that could occur from that. Now, this isn't us saying we think you should do this or should do that, but what we want is for women to have informed consent about the decisions that they're making. You know, if they've discussed that with their doctor and they're having it for a period of time, and that's fine, and they've got another plan, great. But let's not use it as a fill-in for incomplete surgery.
I did read up about this yesterday, and I saw a few comments on y'all's group as well from some of the members saying it doesn't help cure endometriosis, but it helps ease the symptoms.
Because it shrinks the lesion. It shrinks the lesions. It reduces some of the inflammation. But then you can get all of the other symptoms that you would from menopause. And
including the artery problems, the heart problems, cognitive function, bone density loss. So I understand how people feel and how people think that obviously I can get rid of this. And it is only a risk when you take them. It's not the sort of, it's definite, it will definitely happen to you, but obviously it does put you into menopause. That is what it does, and that's how it's supposed to help with the disease. Now, I've never taken it personally. I have been offered it, but I've never actually taken it. And that's my personal choice, and I don't disagree with anybody who wants to take it as long as they are completely informed about what they are taking. What we do see, though, is a lot of people being put on it, and then that's like end of care.
For 12 years, we've been told, they've said, oh, I've been on it for like 10, 12 years. That's not good enough.
Can I ask, earlier you spoke about the importance of listening to people. A few weeks ago, I interviewed another lady from the island who did a petition, and she said the final question was, what would you like, the outcome to be, or something along those lines. And she said a lot of the people that responded said, I want to be listened to. And I did another interview with another female, and she also said, she feels as though she keeps speaking to, her GPs, or she keeps speaking to whoever she sees at the hospital, but she doesn't feel as though she's being taken seriously, or she's not listened to. How important is that, especially with something like endometriosis?
You just get this. They just don't. It's true, they don't listen. You just get disregarded. It's just like Karen was saying before, it's only 2 weeks of every month, just suck it up and get on with it. It's normal. And that is just, we need to move on from that. It's not normal. That needs to be the new normal. That it's not normal. I've got here what I was just looking at while Karen was talking was I found Anna Cooper's story. It was end of last year, I think I shared a story on that. So Anna Cooper, she's 31. She has a charity in the UK herself. She's 31. I think at the time she did the article and the podcast that I listened to, which is harrowing. She's recorded herself throughout various times of the month, just basically going for a wee, just trying to function, just doing normal things. She's done a recording and it was on Radio 2. And basically she's had 17 surgeries. She has a colostomy bag and a catheter bag because she's lost her bowel and her bladder to the disease. When I went for my surgery in December, the surgeon, I spoke to 2 different surgeons because I had it on my kidneys, my bowel, my bladder, and some of my reproductive organs. And when I spoke to my surgeon, he said that obviously it's been almost 2 years since I'd had my surgery, when obviously they'd said that it's too complicated for it to be done outside of an endometriosis specialist. And it was 9 months since the MRI was done by Manchester, where they had spotted it in the various places, but they were particularly concerned where it joined my small bowel to my large bowel. And basically he said to me, there is every chance that during the 9 months it's grown, and depending how it's grown could be the difference between me waking up with a colostomy bag or not.
Yeah.
And I was really scared about going down for the surgery, about not waking up this time. This is my 4th endometriosis surgery, and I was really, really scared about not coming round. I never really voiced it to anyone other than my partner, but I was really scared about going down. And when I come round, the first thing I actually did was pat myself down to see if I had a bag. And thankfully I didn't. He said that the disease had actually, where it was documented, it had been removed in February 2023. It had completely grown back and some. But thankfully, if the amount of endometriosis had have grown back to where the disease had been left behind, I would potentially have lost a kidney and I would be with a colostomy bag. But thankfully, it had grown back to where it had been removed from. So I am unbelievably lucky. Not everybody is that lucky. I say she's 31 and she's had a colostomy bag for a few years now, I believe. And this has all come from not being listened to.
Yeah. If you listen, you can stop that from happening. And that's why they need paediatric pathways. And you wouldn't think you would need a paediatric pathway for something that's considered a disease for women. But as we said earlier, it's the research, if you look into the specialists who actually understand endometriosis and the evidence is there, we said this last year, they think it's congenital. So it's there when you're born. So there is evidence that there is one case study that I read of a 6-year-old having stomach pains. I mean, this doesn't happen obviously often, but it can. And nobody knew what it was. She had a scan. She had an endometrioma at 6. And obviously had to have surgery. So, I mean, that's devastating for a 6-year-old and for the child's parents. So that's why it's really important to listen, and listen to teenagers when they start their periods and they turn up at a GP surgery. I said this last year. They might not have painful periods, but they might have fatigue that's new. They might have a change in bowel symptoms that's new.
Please don't uncomfortable for them to talk about anyway. They're at that awkward stage in life where they're not a young girl anymore, but they're also not a woman, and you need empathy for them to be there in the first place.
Yeah. And how difficult is it for a teenager anyway to not feel embarrassed about talking about those types of things? Just listen to them and get them the right help, and don't say, well, you can't do anything because you're too young. You can. Some of the specialists now are starting to do surgeries and assessments from 16, which is really good, but it needs to be widespread. And this isn't something that's going to happen overnight. But in the next 10, 15 years, this needs to change. This is about...
It's been the same for 100 years, so it needs to change.
It needs to change. And, it's like with anything, this is my perspective. If we foresee what's going to happen and we try and prevent, then we're saving money. Let's not react, and let's not take away the quality of life of these young girls. Let's actually support them to have a quality of life, to feel heard, to feel listened to, so they can have productive lives. And I think that's what's the most important thing. When we attended the Women's Health
initiative, Spotlight on Women's
last year. One of the things that was highlighted, and please, men out there, don't take this the wrong way, but if we get it right for women, we get it right for everybody, because it's the majority. It's more when we look at healthcare jobs, when we look at caring roles, be that caring for elderly parents, children, whatever. Women make up the bigger percentage of those jobs, yeah, and those roles within society. And that's what keeps society running and going. And if we don't get it right for women, we don't get it right for anybody.
We have our own event again in St John's
Methodist Hall,
Saturday the 29th of March, 2 till 3.
Half two till sort of 4:30. It is like meant to be a walk because it's Endometriosis Awareness Month. Teas, coffee. Like last year, we encouraged people to bring along cakes and people did, and some people made like real great efforts.
Amazing cakes.
Yeah, and they did actually yellow ones with like little endometriosis ribbon on, so that was really nice. We didn't get to do much of a walk last year because
the weather was
poured down. But that's why we've got the hall in case you can't. But it's more of a sort of, the walk is more of a symbol of getting together and being there and being a support. So we would encourage anybody to come along, friends, family, you know, it's not just about the person. And even if you don't have a diagnosis and you think I might have that, come along. And I think, like we said last year, yes, we're an endometriosis support group, but you know, you've got polycystic ovaries, fibroids, you know, and often people can have both. And obviously adenomyosis, but that is a form of endometriosis.
So that's why I had my hysterectomy, was for adenomyosis.
So come along, you know, obviously we're doing our best to try and raise awareness and education. So if you've got a health condition that's affecting you that's related to being a lady, to being a woman, just come along and join in.
It's better together.
Yeah.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.